Welcome to the Informed Woman magazine, where science meets clarity and knowledge becomes strength. I'm William Bologna. Let's make women's health understandable together.
What if one tiny genetic change could determine whether a breast cancer responds to treatment or continues to grow, spread, and resist every therapy you throw at it? Today, we're uncovering one of the biggest breakthroughs in metastatic breast cancer, targeting ESR1 mutations. Between 5 and 10% of breast cancers are metastatic at diagnosis, and up to 30% of early-stage breast cancers eventually progress. Most of these metastatic tumors are ER+ and HER2-, the subtype that makes up nearly 70% of all metastatic cases. At the center of this story is a single gene, ESR1, the blueprint for the estrogen receptor alpha. This receptor is like a switch. When estrogen binds to it, it activates genes that control growth, metabolism, and cell development. But when ESR1 mutates, this switch breaks. The cancer stops listening to hormone therapy and begins growing again. ESR1 mutations are rare in early disease, only about 1 in 100 cases. But in metastatic cancer that has been treated with hormone therapy, they appear in 10 to 50% of tumors. They are often acquired during treatment, which means the therapy itself can push the cancer to evolve and outsmart it. These mutations don't just resist treatment. They're tied to shorter progression-free survival and faster recurrence. That's why leading oncologists now recommend routine testing for ESR1 mutations, often through liquid biopsy, when a patient's ER+/HER2 metastatic cancer begins to progress. And now, a major shift is here. Inluriyo, a newly approved therapy for adults with ER+HER2 metastatic breast cancer and an activating ESR1 mutation. It's designed specifically for cancers that no longer respond to standard endocrine therapy. The active ingredient, Imlunestrant, is an estrogen agonist that does something extraordinary. It binds to both normal and mutant estrogen receptors and forces them to degrade. Without these receptors, the cancer cells can't receive estrogen's growth signal, and their ability to multiply collapses. In a phase 3 randomized trial, Imlunestrant as monotherapy outperformed existing standards, including fulvestrant and exemestane, for patients with ESR1 mutant ER+HER2 metastatic breast cancer who had already progressed on endocrine therapy, with or without CDK4/6 inhibitors like Ibrance, Kisqali, or Verzenio. Inluriyo is approved for adults, and in premenopausal women and men, it must be combined with a luteinizing hormone-releasing hormone agonist. The key is accurate testing. If a progressing ER+HER2- metastatic tumor has an ESR1 mutation, this therapy may dramatically change next steps. After years of stalled progress in advanced ER+breast cancer, this is the first therapy designed specifically for ESR1 mutant disease, a subtype that has quietly driven treatment failure for years. This isn't just another drug. It's a precision weapon against one of cancer's most evasive mutations. Cancer evolves, but so does our science. With therapies like Imlunestrant, we're not just reacting to cancer's mutations, we're finally getting ahead of them. And for patients living with metastatic ER+ disease, every new weapon matters.
Thanks for watching another video by the Informed Woman magazine. Please feel free to comment and ask questions. Subscribe for more science-driven medical insights.